Health officials are keeping a vigilant eye on rising COVID-19 cases and making changes to ensure patient safety in hospital. Cleopatra Murphy has the details on why the Minister of Health says the return of some health measures can never be ruled out.
Honey, everything okay?
Everything's fine.
Shop online for free in-store pickup in 2 hours or less.
18 patients are currently hospitalized at the Princess Margaret Hospital with COVID-19, and one patient is detained in the intensive care unit. Minister of Health and Wellness, the Honorable Dr. Michael Darville, has confirmed that due to hospital-related exposures, health officials have reinstated precautionary measures, highlighting the need to protect tertiary healthcare institutions.
You might have noticed that as a result of the case in the ICU, the Public Hospital Authority had to tighten our grips to limit the amount of visitors and the time spent with visitors at the ICU and the hospitals. This is all a part of our strategy to try to mitigate the effect of COVID-19.
Visitors have been limited to 2 per patient for 15 minutes. That's also the same for the neonatal intensive care unit. The Minister of Health maintains the virus never left and assures officials are able to handle the current increase in cases. He also dismissed social media claims that the ministry has confirmed the presence of the Omicron XBB 1.5 variant in the Bahamas that has led to a surge in COVID-19 infections in the U.S.
We have not gotten any report that the new variant is here. I suspect, like when the Omicron variant arrived in the Bahamas, the confirmation took a few weeks and a few months to determine. But for us at the Ministry of Health and Wellness, our job is to be ready for any situation. We are operating as if it is in country, even though we may not have a verification at this time. Samples are usually sent to Panama and Brazil for confirmation with gene sequencing. And we're watching what's going on internationally.
That includes keeping a watchful eye on the country's borders, with Darville noting that a record number of visitors came to the Bahamas over the holidays.
This is good for our economy. And at the Ministry of Health, it is our responsibility to mitigate the risk as it relates to COVID-19 and the economy. I believe that we have done a relatively good job at this particular point. And with all of our technical team, we will continue to do what we do at the ministry and to assure the Bahamian people that our job is to notify them anytime there is an incident that we believe it is worth reporting. And we're looking at it. We're watching what is happening with the Pan American Health Organization. One of the things we must be mindful is when we begin to isolate a particular group of individuals and demand testing for one group versus the other. That is something we're concerned about, but we're mindful to do what is in the best interest of the Bahamian people. At this particular point, we have not made that decision. I do not know if that'll change before the end of the week or next week, but as far as it is today, that is not our plan at this point.
Darville believes there's always a possibility that masks and other preventive protocols may need to be reintroduced at some point. But for now, he says the situation remains fluid. For the Bahamas Tonight, I'm Cleopatra Murphy.